Hi everyone, this is Dr. Mario.
And I'm Dr. Kat.
We are here to talk to you about injectables for jaw joint, TMJ, grinding and cleansing. And Kat does that for you. So Kat would like to tell us about it. I have a number of questions that I'm going to read to you.
Yeah, perfect. So we've had a lot of interest. We've started doing this treatment for patients, and we've had a lot of interest and questions about it. So we thought that Mario and I are going to ask and answer these questions and provide some of this information.
First of all, who is the right candidate for a masseter Botox? Masseter is the muscle that you put the injectables on.
Yes, correct. So the masseter muscle is the chewing muscle, and that's the muscle that sends the force to the teeth when patients are grinding and clenching. The right candidates are patients who have pain in the face or in the jaw joint when they clench, grind, or often when they wake up in the morning. As long as the pain comes from the muscle and not the jaw joint, then this patient is the right candidate. Also, patients who will have evidence of tooth wear on their teeth, like clenching, grinding, cracks in their teeth, and worn surfaces on their teeth, they are also good candidates for this treatment.
Excellent. And how long does it take to feel the effect?
So it can take up to 2 weeks for the patients to feel the effect. It tends to kick in after a few days, but the full effect can be felt within 2 weeks.
Okay. And how does it feel? Can the patient eat normally? Will I drool? Things like...
Yeah, so patients normally do feel like the function of that muscle has been weakened and they're not able to clench as hard as they were able to clench. But you can still eat perfectly normally, you can speak perfectly normally and smile just as you did before. So that effect is not, that function is not affected. We just simply cannot clench and cause damage to our teeth as much as we did before.
And how will I look?
Botox and the masseters can often have a slimming effect to the face because the masseter muscle tends to slim down after the Botox has been administered. Some patients like this look because it makes their face look a little bit slimmer. It's not the case for everybody, but it can have a slimming effect over time.
And what are the possible side effects?
Side effects with this kind of treatment are rare. One side effect is that the response is suboptimal, and by that we mean that it doesn't really work too much for some patients. So for those patients we need to tailor the dosage, and sometimes we do need to add more product, but we've waited 2 weeks and we've seen whether it has worked for them. The other side effect is something called a paradoxical masseter bulge, which is where this is an anatomical variation, and we cannot know this beforehand, but some patients will have a different anatomy of the masseter muscle. So when they clench, one part of the muscle might bulge a little bit more. This can actually be fixed. Correct, yeah. So this can be fixed by injecting some more product in that little bulge. So again, within 2 weeks that should dissipate.
Oh, I see. And how long does it last? And how much does it cost?
The treatment lasts for 4 to 6 months, depending on the function of the muscle and how much that patient is clenching. But usually after 6 months, patients will want another treatment or a top-up. It can cost between $650 and $750 depending on the patient, but we do provide free consults, so anybody's welcome to book that in.
Okay, and they can book online or call and ask for you.
Absolutely, yeah. So a free consult for Botox and the masseter is what you would ask for.
I want to say that many people who grind their teeth, they not only get a night guard, which is a plate that you will wear at night. I think most of them nowadays are said to benefit from Botox or any other type brand. Botox is just one brand of injectables in the masseter muscles. And that's nowadays mainstream. Well, I hope it helps. Bye.
Bye.